we can start with Geoffrey's question, and I think that one will go to Dr. Wamalwa. Are you equipped to handle that one? If you have diabetes and you're expecting, how will that impact you?
We can answer both. I can answer on the baby side, then they can answer on the pregnant mother side.
Dr. Ida, can go ahead.
Yeah. So when it comes to diabetes in pregnancy, there is what you talked about, the GDM, gestational diabetes. So gestational diabetes occurs in pregnancy, and post-pregnancy, the symptoms actually go away up to 6 weeks. It goes away. But these patients are at high risk of developing type 2 diabetes. So when you talk about risk factors, is one of those is those who had gestational diabetes and who had big babies at delivery, babies above 4 kgs. Yeah, 3.94 kg, babies above that. So management of these patients is similar to management of we have type 2 diabetes patients who also get pregnant. We have type 1 diabetes patients who also get pregnant. So management of diabetes in pregnancy is similar in the sense that we have more stricter controls of sugars when it comes to diabetes in pregnancy as compared to patients who have type 2 diabetes or type 1 diabetes. So when we talk about fasting sugars of type 2 diabetes being probably you can go up to 6, we say these patients up to 5.4, 5.6, we don't want you to go beyond that. So we want very strict controls for these patients. So the monitoring therefore happens to be more than the usual when you're usually having type 2 diabetes. Okay? When it comes to therapy, we don't have a lot of medications which are safe in pregnancy because trials with people who are pregnant are usually not done that much. So we only have two actually oral therapies in terms of one metformin. In the country, we only use one, and then the rest is insulin. So this actually becomes a question back and forth when we now tell our patients, now you have to go on injections. So a lot of times post-pregnancy, they go off it because pregnancy is a physiological state where now there are a lot of changes in the body. So the sugar control has to be controlled well, and these changes disturb sugars as well. So these are patients we monitor very closely because they have the risk of losing the pregnancy if the sugar is not well controlled. So patients who come to us and are trying to conceive and they have uncontrolled sugars, we advise them to not try until we get the sugars at least within control. So it's very important for patients who have diabetes to see their healthcare professionals early, so we start supplementing them even early enough with the folic acid because of the risk of complications that can develop with the baby. So it's a high risk actually management when it comes to patients living with who are pregnant having diabetes. Yeah.
All right. On top of that, now the impact on the baby is so grave because.
Sorry, did you want to finish with the mother?
Okay. Another impact. He talked about delivery. And you know, if you have a big baby, that also influences the choice of delivery. So you'll end up having more ladies going through cesarean section than normal deliveries because also this baby can't handle passage through the birth canal. And so you'll find, now that's a cost implication because the mother came anticipating on a normal delivery and then now you end up having a big baby and the risks of the child getting complications, which Dr. Wamalwa will talk about, then goes up. So that also has an influence on the cost, and so we have to be very tight with our control. And if we don't control the sugars well during the pregnancy, then even after the baby is delivered, you start to have mental development issues. When the child is actually in grade 1 and 2, yet when they began with the milestones, they were completely okay. But then you find they're slow in catching up, which is where now Dr. Wamalwa comes in. So we have to be very careful and very strict with our control for our pregnant mothers.
Yeah. Okay, thank you, Rosie, for that introduction. So now the children will be born big. So the delivery may actually negatively impact on this baby because the child may be born with fractures. Some of them may have nerve complications because of that difficult delivery. But remember, this child has been in the mother's womb where there's free flow of glucose through the placenta. And as a result of that, we have high levels of insulin in the baby. Now, immediately you cut off the placenta, we cut off the glucose flow from the placenta. But the insulin levels are still circulating in the baby's body. So you run a risk of having low sugars in the baby immediately after birth, and if you can't monitor that well, you can lose the child. Remember, there's also a risk of congenital abnormalities, and the most common abnormality we normally talk about is a heart defect, a hole in the heart. Or you find that the heart muscle is so thick that the heart is not able to perform its normal function. So that alone can also cause instant death in that neonate. But besides that, again, we have a lot of red blood cells that have been built up in the utero, so they have to be broken down. As they get broken down, the child will develop what we call jaundice or yellowness of the eyes. Again, if it's not managed well, you can have complications. And of course, electrolyte imbalances. The calcium, the magnesium imbalances will be there. But that's not all. If this child pulls through that neonatal period and starts living normally as a child, if you do not manage that child well, the child may also get what we call metabolic syndrome. They may develop diabetes later on, they may develop cholesterol issues later on, they may develop high blood pressure later on, and they may end up in the state where the mother was, gestational diabetes. So it becomes a vicious cycle, and so the only remedy is to break this vicious cycle by ensuring that we optimally manage this pregnant mother who has gestational diabetes.
To be honest, I am terrified to all of that. I would like us to take a break. I know we have questions which are pending, especially on the questions